Gayatri Ramakrishna, Dr. Ivanka Medan, Dr. Mehak Agrawal, and Professor Biva Rani. So for the lighting the lamp, please come. I want to invite Professor B.C. Das sir and Professor Chandradeep Tandon sir to come in the dais, please. So Professor B.C. Das sir is our chairperson, Amity Institute of Molecular Medicine and Stem Cell Research, and Dean of Health and Allied Science, and he is a renowned scientist throughout the India as well as the world. Huh? So it is nothing to give too much introduction about B.C. Das sir. Everybody knows. Sir, I am calling you to welcome the gatherings.
So, so good afternoon, everybody, and thanks, Dr. Viswas. So he is my colleague and the director of the Institute of Amity Institute of Molecular Medicine. So every year he has developed a center for liver diseases, and he works on liver cancer. So that's why every year we observe or celebrate the World Hepatitis Day. So which is today we are observing, but it is generally happen in the 19th April of every year. At the outset, I respected Honorable President Sir, Dr. Ashok Chauhan, our Honorable Dynamic Chancellor, Dr. Atul Chauhan, and our Vice Chancellor, Madam Professor Dr. Balvinder Shukla, and our pro-VCs. There are 2-3 pro-VCs, but research and innovations related, and also he is the Dean of Bioscience and Biotechnology, under which the Hematopoietic Institute of Molecular Medicine and Stem Cell Research comes. That is Professor Dr. Chandradeep Tandon. He is here on the dais. So, and the most important, the esteemed guests and guests of honor and speakers of this today's program. That is starting from Professor Dr. Suparna Chakraborty, who is our also the visiting professor, or no, is a what is not visiting, adjunct professor. Yes, sorry, confused that. Sorry. So, and I know, and he was also the co-guide of the external co-guide of our one of the PhD from Dharmshala Cancer Hospital, Dr. Um, Sarita Jaiswal did the PhD. I think it was last year. It was she got the PhD. So that way he has come several times, and he has been authority in the field of the blood cancer, and particularly the great immunologist, and also the medical persons, physicians. So welcome, Dr. Chakraborty, to this on this occasion, and then Dr. Professor Gayatri Ramakrishnan from the none other than very known institutes, ILVS, from where Dr. Vishwas was there earlier. Then he moved to here. So, so that Professor Sareen is the director and chancellor, but he was my previous colleague from Maulana Azad Medical College and GB Pal Hospital campus, and he was um, annoyed that I hijacked Dr. Biswas from. So he always complained that you have hijacked my faculty. So that is the story. So Dr. Ramakrishnan comes from there, and the Institute of Liver and Biliary Sciences, one of the top institutes, or the only institute rather distinct from the for the liver disease, including liver cancer. Then Ivanka Madan, the consultant associate professor in the Department of Biotechnology Research in Gangaram Hospitals. I am a regular visitor. I am patient to there also. Dr. Sankaracharya, I had the back operation, the spine operation, but I know the lab. Professor Ganguly runs that. An excellent facility. I was telling to Venkat Ganguly, he is the advisor there, and he sits there only. Other place he goes for 1 hour somewhere, but he sits there for a half a day also. I think you are belong to that group. The Rana, what is that? That huh? Yes, and now this there's a lady who is the in this group, very overactive lady, takes lot of initiative in the Arasmirana. Yes, so she's very much I cannot forget her. So she, and she has helped also a lot, because every time Ganguly is not available, though he was my ex-boss as a DG of ICMR. And then Mehak Agarwal, so she is from the Senior Consultant Action Institute of Diseases, Action Cancer Hospital, which is a Balaji Hospitals related, and that's Dr. Suparna Chakraborty has moved there from Dharmshala Cancer Center there, or Dharmshala Hospital here, and she is with him only. So welcome, and then Dr. Pulika Prasad, the Special Center for Neuroscience, Jawaharlal Nehru JNU. So she is reaching. So I am just looking where is she. And Professor Vivarani, Department of Biotechnology, JP University, Information Technology. So I remember this JP Information Technology, that is my backside of my house, there is 62. So I went for a one invited talk once. So I spent half day there one day. So that's why maybe that time we met or something. So welcome. So I welcome everybody on behalf of the university as well as on my behalf. I welcome for this important day of World Liver Day, which is generally observed in the uh, 19th of April. But since 19th is Sunday, and we thought we can observe today, and tomorrow is also Saturday, so we do not work. So it was organized 2 days earlier, and it was actually 2010. It was the European Association for the Study of Liver. So they started this. It was not long back. It is only 2010 that they observed this first for the awareness of the people. And it's important for any disease, particularly liver diseases, liver cancer, or any type of disease. It is very important to have the awareness program. It is though we are doing, it should be actually done in the community, or so that people, those who are not very much exposed, here all the students, their biology background or biomedical science background, and faculty, they are all the, we are in the line of people. But those who are really in the community, they come from different walks of life. It is important to sometime, I think we should do sometime in a community, inviting in this place, or we go to the community and observe the liver day or do the camp or something. So under this banner, so not only this, also cancer also. In general, we do the cancer day celebrations. So this is the awareness mainly, that how we can protect or prevent this disease occurring. Liver disease is starting from jaundice to the metabolic dysfunction to liver cirrhosis to liver fibrosis and fatty liver to liver cancer. So that is the dangerous ultimate. So that is that how we can avoid that. That the most important thing, there are 3-4 things mostly, but it is applicable not for the liver disease, but also good for the other diseases, including cancer, cardiovascular, which I am telling these 3-4 points. That is the main is our awareness, early screening, or for the early detection, and to go for a treatment or for going. Other thing is that how to bring the good habits. So this year theme is that the solid habits and strong liver. So solid habits is what? That you do the regular exercise, walking, if not exercise, walking, and then the uh, absenting from the using over use of alcohol or smoking. So these things, and a good balanced diet. These are all very common things for cardiovascular disease, liver disease, cancer. To all these diseases it can be applicable, and particularly it is the liver diseases for the food habits or your lifestyle is affects this disease, as well as there are also environmental agents or the surroundings and eating, and particularly the diet and the liquid that you use, the drinking water to other things. So that is because it has a viral origin also. It is not because of other things, alcohol and other things, but also it has a viral origin, that it has a DNA virus or RNA virus is there also. Whereas it is, we call it A to Z virus, means it is A, B, C, D, E, F. There are 5-6 types of viruses. So each are very important, but A we do not consider much, because in the childhood we generally during playing we use muds and these things and play in the ground. So we automatically develop the antibody against that. We get the infection, we develop that. But if it happens in the older age, then it is very difficult to and it treat, and there are a lot of problems. But also those who are researchers, work on the infectious materials or clinical samples in the lab, you know or not, we should have told somewhere, and our faculty must have shared that you need to take the hepatitis B available at least. C is also available now, but B infection is important to avoid. So that hepatitis B vaccination is available very cheap, 200 rupees or like that, or 250 rupees. So it is to be taken that you protect from the virus infection. So it leads to a lot of problem, and once it is infected, it remains in the epigeneal state, but if it is integrated, but it is difficult to get rid of it. So this is very important. That's why when the vaccine is given, HBSSG is detected. If it is detected, it means there is antigen is there. So you cannot have the vaccinations. So this is important that you took. There is no problem anywhere. You can purchase and get the injection done. So intramuscular injection. So along with other vaccines you take, but this is also important, those who work with the clinical material or infected materials. So, and I will not take much time, that it is important that we bring awareness to our people around, and it is very good, important that we also invite the staff and the other people, so that they are general people, they can have the exposure that what happens, how do you take care of that. So this is important, and this is the day we, and so daily habits, the liver cirrhosis and the alcohol and the regular screening, and that is for the early detections. So any disease, if you do the early screening by your ultrasound or any other test you do, and it is important to that this liver, fatty liver, and non-alcoholic fatty liver, or that is generally if somebody takes alcohol has a very good connections with the liver, because in India it is important that a lot of people die of liver cancer or liver disease or liver cirrhosis because of lot of use of alcohol, and people enjoy life that we can drink it, and once one is habituated to drink, it is very difficult to prohibit them, and it is a real difficult. I have seen my own eyes, and I have prohibited the level of the security and Chakidar and all these people, and I feel bad that I have also given money. When you are coming out, you will come and, sir, कुछ मानी पैसा चाहिए, हम किस लिए, ड्रिंक्स से लिए, सर बिना एंजॉयमेंट, मेरे को नहीं, बिना चलता नहीं है, मेरे पास पैसा नहीं है, माउंटेन हो गया. So I have given, thinking that, and I have prohibited him that don't do this thing and take little amount and not make it a habit. But 3 times I have saved him when I was in Maulana Azad. Professor Premises Kar, he is now in Max Director, gastroenterologist, liver specialist. He was my colleague. We jointly published huge number of papers along with Sareen also. So he protected, he said that 3 times I have saved him and prohibit him not to take alcohol. But ultimately he succumbed to it and he died. And very young as rather, he was less than 50. And ultimately, I being director, later on I become director of the institutes. His son came for the job because government that son or daughter who can take the job. So I gave his son the job, got to the ICMR, and he is still serving. But one thing I told, don't take the habit of father, don't be drinker. So he is fine and he is doing. So with these few words, I once again welcome you all for this excellent discussion, that all the experts are there. They will be sharing their experience and how to protect from the awareness and how to protect from any type of liver disease, including liver cancer. So thank you very much. Thank you, sir.
Thank you, Professor B.C. Das sir, for educate us regarding the Liver Day and the history. Just I want to mention that is, sir is mentioned about the liver. They started with the initiative of EACL, that is European Association of Liver Disease, and the same kind of the big association also present in America. It's called ASLD, American Association of Study of Liver. ASLD. When we have, when sir also mentioned about Shivsarin sir, actually he has initiated in Indian society also. It's called Indian National Society for Study of the Liver, NASL, and he got lifetime achievement award last year. I was there in Chandigarh. So so anyway, I'm not taking too much time now. Want to invite Professor Chandradeep Tandon sir, our Vice Chancellor, as well as Dean Hill as Allied Science. Sir, please.
Thank you so much, Dr. Biswas. On the behalf of respected Founder President Sir Dr. Shokya Chauhanji, Honorable Chancellor Dr. Atul Chauhanji, our Vice Chancellor Dr. Pravinder Shuklaji, on behalf of our very respected Dr. B.C. Dasji, on my own behalf, I once again very warmly welcome all our panelists, especially for throwing light and enlightening everyone on this about liver health awareness. And also, there is going to be a panel discussion. Dr. Biswas, correct me if I am right, on the theme solid habits and hematopoietic prepare for strong liver and cancer therapy. That is very good, and Dr. Das also rightly pointed out. Diet plays very important role not only for a specific disease but holistically for all diseases, whether it's cardiovascular disease or any other disease. I mean, healthy diet. And of course, exercise, as Dr. Das rightly pointed out. So, having said that, this World Hepatitis Day is observed every year to increase awareness about liver health, to promote prevention strategies, encourage early detection and treatment of liver diseases. And liver, we all know, is one of the most important organ which can regenerate also itself. The general mantra of World Liver 2026 is solid habits, solid liver, strong liver, strong liver. Even if I say solid liver, doesn't matter. Liver should be solid. Well, I'll tell you briefly about MIT University for all our guests who are here. MIT University is known for its research and innovation, which is evidenced by high number of publications, projects, funded projects. We publications as of now more than 30,000 publications. We have projects in crores. We have patents to the tune of 460 plus. These are patents. We have granted patents. So we have filed patents, more than 2,700 patents already been filed. So this is brief outline of MIT University, what MIT University is briefly doing. Otherwise, there is a big list. If I start with that, there would be never ending. But Dr. Das has been very descriptive in his words, so I will not take much time. All I would like to say is, Dr. Das very rightly pointed out that Dr. Biswas, this is again a request to you. We should have, like you have cancer awareness program. Remember, it was we also had a walk and everything. So on similar grounds, if we can have awareness for liver health also, where everyone is involved, right, including our faculty members, staff, scholars, PhD students, together university, like we had it. Remember during helipad. So that would be very good. That would be very nice. So that would be of great benefit to masses. That's what should be. Yeah.
Actually, I wanted to do that also, but problem is next time examination.
I know. I understand.
Last semester classes are there, so a lot of students are involved in internet exams.
Yes,
so
yes.
I was instructed from sir as well as Master sir to restrict in the.
That is very nice. That is very. I know. So I really welcome all our esteemed faculty members, all students. I can see so many students there. These programs are very, very important. We learn a lot regardless of our age and experience. So, Dr. Tolik, welcome, Dr. Tolika. Welcome. Please have a seat. So, with this, without much ado, I would take it forward and would invite next speaker as per the plans of the program, Dr. Biswas. Thank you so much once again. Thank you.
Thank you very much, Dr. Tandon sir, and I like to invite Dr. Ivanka and Dr. Gayatri to felicitate Professor Tandon sir. And inviting Professor B.C. Das sir, please. And Subarna sir, please. So thank you very much, Professor Chandradeep Tandon sir and BC Das sir, who started the program. So now, without um, delaying, we are going for the panel discussion. That is the difference I made this time, because every time we do and engage with the skin lectures. So instead of that, whatever the question we have, because a lot of graduate student as well as postgraduate student along with PhD student are there. So it will be totally scientific debate, and they can free to ask the panelists. They all of are very expert in liver research, tumor microenvironment, mRNA delivery, nanoparticles. So I am like to invite our panelists in the dais. Professor Suparna Chakraborty is a principal director, transplantation and cellular therapy, Action Cancer Hospital and former hemato-oncologist Dharmashila Narayana Super Specialty Hospital in Delhi. Professor Gayatri Ramakrishna, Institute of Liver and Biliary Sciences. So no need to introduce. She is my senior, and Suparna sir already associate with Amity Institute of Molecular Medicine and Stem Cell Research, and he is an adjunct professor in our institute also. Dr. Ivanga Madan, consultant and associate professor, Department of Biotechnology and Research, Gangaram Hospital. So Ivanka, we had a lot of interaction in terms of the MASIL, because she worked on metabolic disorder in the term of the liver disease, and she has a big background of dyspnea also. So she will talk about that. So Dr. Mehak Agarwal, senior consultant, Action Institute of Disease, Action Hospital. She has a long expertise on NK cells as well as bone marrow transplantations. Dr. Tulika Prasad, she is also my senior from Jawaharlal Nehru University. We work together in the same building, and she is now from Special Center for Nanoscience, and she has an expertise of nano delivery, quantum dots. So a lot of good feedback we'll get from Tulika ma'am. And Dr. Biva Rani, she is also in the same platform, Jawaharlal University, but she is now Department of Biotechnology, JP University of Information Technology. So welcome all of you. So in the panel discussion, what we decided to do as a moderator, I myself, and I'm inviting Dr. Marian Sarawat. He is from Amity Institute of Pharmacy. So she will moderate the program along with me. So sir, you all of sir and ma'am, all of you will be the dais, and I will be through the question. And before that, in between, the student also can ask the question. Okay. So can we, with your permission, can we start the panel discussion? Thank you, sir. Good afternoon, everybody. So. So as I mentioned that Professor Suparna Chakraborty is working for a long experience of the bone marrow transplantation, and in India as well as before that he was working at the United Kingdom for a long time, and was a surgeon plus expert in hematopoietic stem cell. So sir, I am starting with you as a senior panelist in this panel member, because as we know that is you are a bone marrow transplant as well as long studies publication based on hematopoietic stem cells. But though it's a liver World Liver Day, so I'm starting with the questions of the liver, because liver it is known that that is a in the cirrhotic patient as well as in the carcinoma, that there is a issue with the hematopoietic stem cells, bone marrow, and the bone marrow transplantation and as well as hematopoietic stem cell transplantation also one kind of therapy, as well as along with the hematopoietic stem cell. mesenchymal things is already important. But still the doubt is there in the community in India as well as throughout the world. That is why CD133 population rates, hematopoietic stem cell population is not in the clinical trials because a lot of restriction over there. So I'm starting the open question with you. I think hope you like my questions.
Yeah, thank you, Dr. Shubhajit. I don't know. I mean, I see a lot of students over here. How many of you are aware between the bond of liver and the marrow? Can anyone tell me when the bond starts? Hematopoiesis, liver and the marrow. There'll be a chocolate if you can answer it correctly. Anyone?
Monica, you can answer.
Yeah. So there is one due for you. Yes, from the yolk sac, the hematopoiesis moves to the liver at the fetal stage by 4 to 5 weeks, and it's only just before the delivery that hematopoiesis shifts to the marrow. So for good 7 months in the womb, liver has maintained hematopoiesis, and it comes in waves, like not at one go, but hematopoiesis develops in several waves. So first is to you know what. So what is the first thing a fetus would need to sustain itself? So there are three components of hematopoiesis, as you know: erythropoiesis or the red cells, leukopoiesis or the white cells, and thrombopoiesis or the platelets. So which one would a fetus need to survive in the womb primarily? So it's the erythropoiesis. You need the red cells to carry oxygen around the body. So the first wave of hematopoiesis is erythropoiesis, which is sustained for the first couple of months, and then the others follow. Even before leukopoiesis, it's thrombopoiesis, which is more important in the fetal stage. And it has, I mean, largely, these are all mice experiments. What has been seen is, thrombopoietin, which is responsible for megakaryocyte formation and maturation, is one of the key hormones or cytokines in utero which maintains hematopoiesis. So the liver does the job of the mother for the marrow, which is it sustains hematopoiesis until the marrow is ready to take it over. Now, what is interesting is that is the liver capable of doing it in an adult stage as well, or in adult life? So the fetus is out, the child is grown, it's grown into a man or a woman. So can the liver sustain hematopoiesis? The answer is to an extent yes. So what happens, what we see as hematologists is that, so when the bone marrow fails or the bone marrow is fibrosed, and there are the hematopoietic stem cells naturally migrate to the liver, and this is called extramedullary hematopoiesis. Liver sustains the hematopoiesis when the marrow cannot do it. So there is a very, very intimate relationship between the liver and the marrow, even in the adult life. Now that raises the question that, okay, liver is sustaining marrow, but can marrow sustain liver? That is what Shubhrajit is asking today. And this is a question which has been asked over the last 3 decades, that what is the treatment for a failed liver or a failing liver? It is a liver transplantation. Now, liver transplantation is not just a casual business that you take a liver, give a liver, put a liver. It's not like that. It's one of the most difficult surgical procedures in the world. Perhaps second to small intestinal transplant. But what is unique about liver transplant is that the liver does not express class 1 antigens as any other organs. So the HLA mediated rejection is not there. So in that way, a liver transplantation somehow, supersedes the HLA matching that's needed vehemently for marrow, definitely for kidney to an extent, and other organs, but liver doesn't. So liver is unique in many ways. But the question that is being asked is, can hematopoietic cells sustain the liver, or can cellular therapy sustain the liver? Now, hepatocyte infusion has been shown to regenerate hepatocytes to certain extent, and not just hepatocytes. Hepatocytes are 80% of the liver, but other 20-30% are the other cells, including Cooper cells, etc. So that's a natural, therapy that you give hepatocyte for hepatocyte. But how would you generate hepatocyte? It's not that easy. But you have forever, ever young and omnipresent source of stem cell. As you know, that stem cell is something that can repopulate itself and it can differentiate into the subsequent populations. So the only regenerating stem cell apart from the intestine and to some extent the liver is the bone marrow or the hematopoietic stem cells. Now, for the last 2.5 decades, there has been enormous effort to see whether hematopoietic stem cells can be pushed to produce other cells, the neural cells, the cardiac cells, the liver cells, etc. And liver has been, huge interest because of their intimate in utero relationship. So,
that's also shown that it's actually treatment leads to the mobilization of the hematopoietic cells, not a core to the liver.
So there has been attempts to, as Shubhrajit said, that in the late 1980s, early 90s, recombinant growth factors came into the reality, and one of the first ones was the granulocyte growth factor, or GCSF, and other was GMCSF, granulocyte monocyte macrophage growth factor. Now, what they do is, apart from mobilizing granulocytes, they mobilize the hematopoietic stem cells, or to be precise, CD34 positive hematopoietic stem cells. Now, these cells, when they go to the liver, if you just directly infuse to the liver, in mice experiments, it has been seen that the liver can sustain them even in adult life, as we know. But can they sustain the liver? That is the key question that has repeatedly been asked. And it has been seen to an extent that somehow, which is exactly not known, they have helped in sustenance of hepatocytes. Now, that led to a huge interest that let us use GCSF to cirrhotic patients and see if the liver can be regenerated. Well, some of these studies came up with some positive results, some came up with a blank, and most said that this does not work. But there is some proof of principle to say that hematopoietic stem cells, if they are present in the liver, they can actually, to an extent, help in sustenance of residual liver function and maybe help regeneration of some of the hepatocyte functions. So, Why there is a lack of interest, as you said, is because we have not found the missing link, or we have not found the best way to do it. GCSF was thought to be an easy way of doing it, but once you get this peripheral, once you get the hematopoietic stem cells from the marrow niche into the periphery, it's not necessary that they are going to go to the liver. Liver has a hematopoietic stem cell niche, but the biggest stem cell niche is the marrow itself. They get trapped in the lungs to a large extent. So they will be in the alveolar macrophages. They often have a tendency to migrate to the intestines. And it has been seen that, after a bone marrow transplantation, that donor stem cells or the donor organ stem cells can be found in liver, the heart, the intestine, and even the neural tissue. So there is a possibility, there is a propensity for the most immature hematopoietic stem cells or the pluripotent stem cells to actually transdifferentiate into other organs. So that's where we are here today.
It's wonderful to see the release as a proper stem cells and the I'm sure the various students.
Why didn't you share diets only? You people are just trending moderators. Please join us here only.
No problem. Yeah. That is the way we work. Yeah.
So I'm sure many of the students are interested now in doing certain kind of research. Are you interested, students? Do you have any questions?
Any question regarding that? Because it's a panel discussion, open to all. If not, then you can go next question.
The next one, study highlights the role of isolation enhancing immune response via NK-ADC pathway. So how can this immunomodulatory approach translate to chronic liver?
So I think Dr. Mahek will address this from the NK perspective.
Thank you, Professor Maria, for the question. So, liver actually, if we see, liver is a remarkable immunological organ as well. So, it not only has the circulating immunosurveillance, there are resident natural killer cells also that are present that are specific for the liver, and these are different from the circulating NK cells. So, these NK cells that are present in the liver, along with the circulating NK cells, they are not only responsible for protecting the liver from the various insults like infections, etc., but they also protect the liver from fibrosis and ultimately developing into HCC. So yes, there is a role for immunomodulation for NK cell therapy in HCC, given the fact that NK cells are so involved in the protection of liver. So, and it has been seen that in HCC, the developmental pathway for development of HCC, there are various mechanisms by which there is NK cell dysfunction, which leads to HCC. And the prognosis of hepatocellular carcinoma is very much correlated with the function and the numerical value of natural killer cells. So if the natural killer cells, they are low in numbers, these patients do worse as compared to patients who have a good, robust natural killer cell repertoire. So yes, there is definitely a role for natural killer cell therapy and immunomodulation in protection for HCC.
साउंड थोड़ा सा इसके नहीं होगा तो सुनाई नहीं दे रहा आई थिंक थोड़ा सा साउंड वॉल्यूम बहुत कम हो रहा है अगर पॉडियम माइक से तो हो सकता है पर सबको यहाँ आके बोलना पड़ेगा हाँ anyway can I go for the next question though? Okay, so yes, when Dr. Mehak already were discussing about that in the NK cell. So I have another question because your study was demonstrate the prolonged immune exhaustion post COVID-19. So that is also area I want to bring here because all of us has faced the COVID-19 the situation, and Dr. Mehak has a intensively work on the COVID-19, particularly involving T cells and NK cells? And how might similar immune exhaustion mechanism affect the liver disease, especially chronic viral hepatitis?
So what we see apart from chronic viral hepatitis, also in alcoholism, is the natural killer cell dysfunction. So those are the other mechanisms by which natural killer cell dysfunction happens in liver disease. So the apart from in chronic viral illnesses, the natural killer cell exhaustion is seen, and also in the tumor microenvironment there is expression of PDL1, which causes the exhaustion of natural killer cells and T cells.
Right.
So one of the markers for development of HCC that we see is this NK cell exhaustion along with NK cell dysfunction, which could lead to progression of hepatocellular carcinoma.
Okay, great, thank you. Student, any question about that in the COVID-19? And yes. Okay, Mirabi student. Okay. So any questions with the student? If not, so Dr. Marian, you can ask the next question.
So this is again for Dr. Mahek. As we were studying one of your papers, like you observed the upregulation of T cells and the NK cells in patients who relapse, especially in the COVID-19 case. So could these immune checkpoint pathways also play a role in liver cancer progression or immune escape in HCC, especially?
So one of the reasons for the development of hepatocellular carcinoma is immune escape mechanism. So apart from these exhaustion markers that we see, the other mechanisms are one of the very potent mechanism of NK cell cytotoxicity is via the it's via the NKG2D pathway. So NKG2D is a very potent activating receptor for NK cell cytotoxicity. And the ligands for NKG2D are MICA A, MICA B. So once MICA A, MICA B are recognized by NKG2D is when NK cells would in the expressing cell. But what happens in hepatocellular carcinoma is that these MICA A, MICA B are shed from the tumor cell surface. And once they are shed, they are saturated by the peripheral circulating NK cells, and the residents and the NK cells that are in the liver will not recognize these hepatocellular carcinoma cells. So that is another way of immune escape mechanism for hepatocellular carcinoma. So yes, the immune escape mechanisms are there, and that is why the role of immune checkpoint inhibitors in hepatocellular carcinoma is very much there.
Okay. The voice.
Audible. It is not audible in the back, and then you feel any speaker, please help the audience. Not answer to her.
Thank you, sir, for the suggestion. So,
yeah, sir is very right. It should be audible to all the students and all those present here.
so when we are talking about the NK cell response and all, so let's move to some of the inflammatory response, and I'm questioning to Dr. Ivanka. So we are interested here in inflammatory response, especially in the cancer patient. How you are using those prognostic biomarkers? Because you are from the Gangaram Hospital.
Yeah.
And
Thank
so
you.
I'm going to take the questions.
First of all, thank you
Yeah.
for inviting me and be a part of this forum. So, as you mentioned, like how the biomarkers can be used as one of the prognostic, the upcoming field for cancer patients. So, as I would say, like inflammation is no longer, just a side effect. We could say it is a kind of a more of like systemic inflammation, more of immunological disorders. We may say. So inflammation seems to be playing a major role in cancer progression, mainly influencing the tumor growth, angiogenesis, and immune evasion. So here, if I talk about biomarkers, there was one of the studies we recently published in Frontiers in Oncology. So where we came up with 3 cytokines, major like the biomarkers and prognostic biomarkers we had put up, where IL-2, IL-23, and PD-L1 were the major ones. So as like for treating cancer patients, so these cancer patients normally what the host immune response does, It mainly targets like the ones which were already known as clinically evident biomarkers which were available. Like we had this MMR was there, TND was another one, and PD1 was there. So, but they were associated with few limitations in kind of addressing the therapeutic or a treatment response. So, thereby we had to look out for few cytokine as the promising biomarkers, few cytokines which may act as prognostic biomarkers at an early stage, so that we can come up with a, where we also implemented multiomics as one of the techniques where we can integrate all the three, metabolomics, lipidomics and proteomics, so as to, to address the patient heterogeneity. Like, because what we need in this day, like till date, as we have been focusing on, so what we need to shift the focus is from the, just we have to change from, like as it's been said, that prevention is better than treatment. So from focusing on rather the late stage prevention, we should always, treatment, we should always focus on the early stage, prevention, and both as a prognostic and a predictive biomarker along with the precision medicine, where all the patients, like one size doesn't fit all. So where we need to address all the patients individually, like which therapy would work better for which patient. So for that, we need to go for multiomics, where we can come up with a few biomarkers, where cytokines are acting as one of the upcoming, the biomarkers where we can use them so as to prevent the like mashal to mash and then leading to fibrosis, thereby culminating into liver disease.
When we're talking about PD1 and the therapy, then and progression of the disease, there also one issue in the age. Aging also one matter.
Yes,
so right. So how you would
yeah, so that way I would say that, of course, like one of the recent study which I think like these days inflammation has been seen to be very much correlated with cardiovascular disease,
Yes,
as you were
cardiovascular.
mentioning, where inflammation is playing a major role. So we are having two ongoing projects. One is on heart failure, another is on MI patients, ASCVD patients we are addressing. So there we had stratified, categorized them into young MI and old MI patients. So as we can see through our data, so what we could say is that the term which has been known as, inflammasome, like where we have this aging is also there. And another thing is this immunosenescence, where the elderly patients being seen that they respond differently from the younger population. Why? Because they have they are immune compromised. So thereby the biomarkers which may act in a younger population may not fit for the elderly population. So we will need to look out for a better or maybe a different biomarker set which may act for these elderly patients, not for the younger population. So what is required is to look out for the biomarkers which may help in risk stratification, in better treatment response, along with, identifying those population who are more prone to the higher complications, I would say. Yeah.
Thank you very much. Maybe Mariam has more questions.
Yes, yeah, sure. So, have you identified any biomarker as such?
Yes, sir. What we have, like for the HF, I would say we have been focusing on three subsets. One is the reduced ejection fraction, preserved, and the mildly reduced. So when we what our main focus was on the reduced ejection fraction patients, because they are more prone to cardiovascular mortality. So there we could find the top three were IL-17 as one of the major inflammatory markers, TH17 driven. Another was galectin 3. And third, we are focusing on the angiogenic part, where we have come up with placental growth factor and FLT pathway. So this PIGF FLT pathway is acting as one of the major, pathways which we can dive into and look out for a cardio-renal link, so as to come up with a early prognostic biomarker as a treatment for these patients.
Thank you for your insight, Dr. Ivanka. One of my question is how this is related to the macrophage cells. Like it is also very important in terms of the therapeutic aspects. So balancing macrophage plasticity during liver disease progression. Like what is your opinion on that?
If you talk about macrophage plasticity, I would say, which students are aware of, we do have M1 and M2 polarization. So M1 are the ones which is mainly related to pro-inflammatory cytokines, which mainly drives towards the anti-tumorigenic activity. And M2 is the one which focuses on anti-inflammatory molecules, which drives towards the pro-tumorigenic. So when we talk about, as you mentioned, the role of inflammation in driving this macrophage plasticity, so there IFN gamma and of course TNF alpha again, the IFN gamma being the major player here, so it acts as a driver, like in response to this IFN gamma. Few epigenetic factors like STAT1, it is mainly a JAK-STAT pathway which gets activated in response to IFN gamma. So when it goes and activates, so what happens, we do have some chromatin remodeling complexes like SWI, SNF complexes, And we do have other methyl transferases which are there, which mainly, what it happens, it wraps it condenses the chromatin so that the transcription gets reduced. So that way, these 2-3 molecular pathways are there which gets activated in response to IF and gamma, and this is how it modulates the macrophage plasticity more towards the M1 polarization. So this is how it prevents evading the immune system so as to help in parasite clearance or any infected patients we have.
That's wonderful information. So now I would like to ask Dr. Vibha Rani one of the questions. As I've seen that your work is on herbal compounds, and I've also worked on various herbal compounds and their effects on liver cancer, as we were discussing. And one of the our drug, Dawal Kurkum, is going for clinical studies. Your work on garlic, how it affects the liver cancer.
Thank you, first of all, for inviting in today's panel discussion. I am into natural product research, and one of my prime area is on anti-cancerous drug-induced cardiotoxicity. So my research is all about the cardiovascular system. So when we talk about the natural product as a whole, I can see many students are here. Can I ask, come out from your mobiles now? What is your understanding about Indian medicinal plants or natural products? How confident you are when you are consuming these natural products? Confidence hai? No? They are a magical molecule, I'm telling you.
Any idea about herbal medicines?
नहीं आइडिया तो है बट वो पूछ नहीं रहा बेटा क्वेश्चन के ऊपर मेडल भी है प्लीज हर्बल मेडिसिन
Anyways, I'm sure you know every day we are having one or the other natural product routinely.
natural product sorry
Why do we eat food? Just for taste or any other purpose?
one
For energy only? Nutritional property. Any medicinal properties there in any food? Do you know? Yes? So that is what we are talking about here. Your food.
Anyways, the present day therapeutics, they have a kind of toxicity concerns and they have the non-specificity concerns. And they are working so fine. They have the potential to cure the disease, but then they do have the toxicity concerns. And in that regard, the natural products, they have come up as a magical molecule. And just go today again and serve 2015 UU2. She's the Chinese scientist. She got the Nobel Prize for her discovery on a natural drug, which is anti-malarial drug isolated from Artemisia plant. It was one alkaloid. So the natural products, from their time onwards, I got very excited. Let me just do this natural product research as well. And I started with few molecules. Curcumin was my first molecule, and I got my first young scientist project on that. In regard to the cardioprotection, similarly for aged garlic, also the garlic which we are consuming every day, So natural products we are eating every day through diet or through fruits and vegetables, but then they have some issues, the solubility issues, the poor absorption is there. And because of that, we are not having the kind of effect which we are expecting. So natural products, there are the secondary metabolites which are present in your medicinal plants. There are different ways you can isolate them, and then decoction methods are available. There are many methods are available. When these secondary metabolites, they have a different kind of solubility as well. Few molecules are polar, few are non-polar. So it's a very sophisticated kind of subject. One has to definitely take it very seriously. So in that regard, the question comes again, the aged garlic. So there is a garlic and another word is the aged garlic. So there is a difference between these two. The difference is that the conventional garlic which we are consuming, it is having unstable kind of sulfur molecules. Allicin, there are many compounds which are there, but they are unstable. Whereas aged garlic, when you keep that garlic into alcohol for longer period of time, then these molecules, these sulfur-rich compounds, they are getting stability. And it has been observed that they have very good role overall in our system, in the human, particularly for heart, because they are the antioxidative molecules. And whether we talk about the cancer, we talk about cardiovascular diseases, diseases, the ROS is playing very, very important role. So in that regard, these aged garlic molecules we used for cardioprotection, and we have seen that the aged garlic stable sulfur compounds, they have the potential to suppress the marker genes which are there in the heart failure conditions, like there is ANF is one such gene, ECM remodeling is there. So these garlic compounds, they suppress those kind of modulated typical features, and thereby preventing the cardiac diseases. There is a term which is hypertrophy. I'm just leaving few terms here for a student's point of view. There is a term hyperplasia. There is a term hypertrophy. When we talk about cancer, it is the hyperplasia, uncontrolled cell growth is there. But when I talk about the cardioprotection, that is the term hypertrophy. So in most of the internal organs, the hypertrophy is witnessed, which is the cells are terminally differentiated cells. Once they are divided, they will not divide further. So what if when we are giving the anti-cancerous drug, or when we have any kind of stress conditions, say it diabetes or anything, metabolic disorder we are covering today as well. So these ROS, they damage the cardiac cells, and then the cells, remaining cells, they try to increase in size without the division because they don't have capacity to divide. So they just increase in size without the division, and that term is known as the hypertrophy. So in cardiac cell, we witness the cardiac hypertrophic conditions, particularly in the ventricles, which is there, and there are certain fetal genes which are be expressing. And this aged garlic, or let's say curcumin, and I have many such molecules, natural products which I'm working, they have the potential to normalize the expression of those fetal genes. So we have been doing the proteomics kind of studies and trying to find out what all genes are modulated and what is the effect of the natural products, aged garlic and all, in the modulation of those marker genes which are expressing and which are responsible for the cardiovascular complications.
Thank you, Dr. Vibha. You already mentioned about antioxidant property and all of this known, and you also mentioned about the different etiology. I mean, it depends on the gene expression also. So I am moving towards the one Dr. Gayatri Ramakrishnan, because she worked on genetics and in the hepatocellular carcinoma. So, ma'am, etiological risk factor which impact ACC most? All of you know, because it's impacting. So could you please elaborate what is the trends we are with data in terms of India? Because you are working for a long time in India in CBAP, then in ILBS. So that question I'm asking you to educate us.
First of all, thank you all for inviting us, and I think it's time for me also, although I work in a liver institute, but I think even I don't know the liver as much.
Yes, yes.
There is so much to learn about.
Mike.
Hear me? Okay. So what I'm trying to tell you is, although I work in a liver institute, but I think even I don't know much about the liver. The reason being, if you just ask what your liver is doing or what your liver is, before we answer that question, let's ask. So I think I'm audible now. Am I audible? I think because I speak anyway very loud. So how many of you know where your heart is? देखा दिल कहाँ है? यहाँ है, कहाँ है दिल? लेफ्ट में है, ठीक है? और लिवर कहाँ है? राइट में. अच्छा, लेफ्ट ठीक होता है या राइट ठीक होता है? राइट ठीक होता है. ये एसएफआई के किसी बंदे से पूछना, जेएनयू वाले होते हैं जो लेफ्टिस्ट होते हैं, वो बोलेंगे लेफ्ट ठीक है, बट आजकल क्या हो रहा है? राइट इज राइट. So I learned in Liver Institute that liver is a righteous organ. Righteous is a word which comes from English dictionary, right? If it is a righteous organ, it's also a virtuous organ. And if you just type in Google, you don't have to go for PubMed also. Just type in Google liver के function क्या है. सबसे पहले आता है 500 functions of the liver.
So that's quite mind-boggling. Why an organ like this has so much of a function to do, right? And if it is so much doing function, you can think any of these function going here and why, there may be some disease or the other, but you will never get to know, right? So what Dr. Shubhajit was asking was, what is the etiology, if I understood his question properly, and how it is then progressing towards the cancer. But we are not even going to talk about the cancer. First, let's know what a normal liver is doing. It's doing hundreds of functions, of which the most important is detoxification. Madam said curcumin. Now the curcumin that you take, any food product you take, that needs to be converted. Somebody said nutrition and energy. So where is all this happening? This is happening actually going, getting digested in your digestive system, and then many of this then goes and circulates down into your liver where the detoxification takes place. So it's something like a garbage industry where every time whatever junk you are eating, because sir was saying कि आप exercise करनी चाहिए, आप खाना ठीक से खाओ, तो वो सारा फैट कहाँ जा रहा है? आपके एलिमेंट्री ट्रैक से लिवर के अंदर जाता है और लिवर को काम करना पड़ता है. तो आप तो खा रहे हो, बट काम कौन ज्यादा कर रहा है? आपका लिवर कर रहा है. ठीक है? So on a daily basis, liver or any for that organ is working 24/7. So there is no Saturdays and Sundays. They are not on a holiday. They are working. Right? And what sir said very rightly was, he asked the question कि सबसे पहले hematopoiesis कहाँ हो रही है? In fetal hematopoiesis is occurring where? It's actually occurring in the fetal stage by the liver. And long back in the Ayurvedic sciences, they call liver as a rakta dhatu, यानी कि वो ही रक्त बनाता है. बट एडल्ट में जाके क्या होता है? जब आपका आरबीसीज ब्रेक डाउन हो रहे हैं, इसमें स्प्लीन में, तो वहां से बिलिरुबिन जो आता है वो लिवर में आता है, एंड इन द लिवर इट गेट्स कॉन्जुगेटेड एंड देन एक्सक्रीटेड आउट थ्रू द bile. Now can I ask, although it's not a good question to ask, did anyone ever had hepatitis or jaundice for that matter? मुझे खुद को jaundice हुआ होगा.
Right.
jaundice किसी को नहीं हुआ? पीलिया सुना है? तो पीलिया में क्या जाता है? रंग बदल जाता है, येलो हो जाता है. ठीक है? तो अब अगर ये jaundice हो रहा है तो किसकी वजह से हो रहा है? तो the etiological factors what Dr. Rajit was asking, you can categorize them as a virus, and in the virus, sir is an expert here. It's A, B, C, D, E. And you people have the MSc microbiology, so how many of you can tell hepatitis B virus is an RNA virus or a DNA virus?
Please.
Have you read virology? Hepatitis B.
RNA virus.
It's an RNA virus? It's actually a DNA virus. Okay? Okay? And you should learn from sir. Sir is an expert. He's actually a national
Sir is
figure in
expert
virology.
in hepatitis as well as sir is expert on curcumin also, that I want to say, because
Right.
sir has a long
So
term.
these are all called hepatotrophic virus. They infect. And recently what I learned in ILBS is also that the dengue virus can also infect the hepatocytes. I also learned that COVID-19 virus, the SARS-CoV-2, can infect cholangiocytes, which are also a part of the liver system. So there are many viruses that can attack. But not everyone gets this viral attack. But definitely you will do if you had Golgappa like how I had. And I ended up getting a HAV virus. And many a times a virus like HAV and HEV can be fulminant. Fulminant means it can kill your liver. And at that time we have cases in ILBS. Although I am not a clinician, I am a basic researcher like all of you. We get to hear in our classes that how many transplants recently they have done for HAV. So these come up in flares. Okay, so these were the viruses. But what sir talked about very nicely is you need to all do exercise. You need to all have a healthy diet to keep your, not only your liver, but also maybe a glowing skin and a beating heart. Right? So for that, it is your nutrition. And in the nutrition, what is happening these days? Two things is happening, especially with the younger generation. Mobile, ऐसे ही कर रहे हैं ना, पूरी रात टीवी चल रहा है, पॉपकॉर्न चल रहा है, तो we are, so what we are doing? They're slowly adapting towards a Western culture.
Right.
So हम सुबह सोएंगे, हम रात को जागेंगे. तो आपने क्या किया? आपने तो सुबह कुछ किया ही नहीं, बट सुबह तो आपके लिवर को काम करना है. बट आपने क्या किया? उसको रात को भी काम करवा रहे हो जबरदस्त, क्योंकि आप खाते जा रहे हो और न्यूट्रिशन तो आपका डाइजेस्टिव सिस्टम भी काम कर रहा है, लिवर भी काम कर रहा है. तो आपने उनको रेस्ट दिया? रेस्ट नहीं दिया. And what is known, and Sir can also tell better, many times they say that the regeneration occurs much better during the night. So there are some circadian patterns. So what is happening now is, if I look at the etiology, the question which was asked, till maybe 2000 and 2012, much of the liver disease was predominated by the viruses. But post adopting to a westernized culture, there's a lot of intake of alcohol. So there's a lifestyle change. Together with the alcohol, you also have, so alcohol to khair sab nahi peete hain, but we also have a lot of fatty food diet. तली हुई चीजें खा रहे हैं, पिज्जा और बर्गर का जमाना. So if next time you go to a McDonald's, ask yourself how much calorie you have taken and how much of those fat you are depositing in your liver. So that condition is now called as a fatty liver. And a study recently done from ILBS and many other places is diabetes goes hand in hand with the fatty liver. So now there is shift in the spectrum from the virology to more of the lifestyle disease. And in ILBS, almost 40% cases which the clinicians are seeing is actually that of alcohol use. And how the liver progresses, it's a very soft organ. And Sir was saying about bone marrow fibrosis. So this also goes to a fibrosis. So fibrosis क्या होगा? जब आपका बहुत soft है, तो वो थोड़ा सा hard हो जाएगा. उसके बाद वो बहुत ज़्यादा hard हो जाएगा. और अगर आप लोगों के many students come to ILBS for their training programs, and especially school students, तो वहाँ पे उनको पैथोलॉजी का राउंड दिया जाता है स्टूडेंट्स को. तो उनको ये बताया जाता है, देखो ये लिवर है और ये बिल्कुल जिमीकंद की तरह दिखता है. जिमीकंद देखा किसी ने? Black, red, dark, hard. It's even difficult to cut through a knife. So that's how a soft organ, you have turned it into a hard organ just by the way you are keeping your health by eating all these foods. So recently we did a very funny experiment in which we took the animals, the mice and the nocturnal animals, right? So वो रात को जागता है, तो हमने क्या किया, उसको रात को भी खिलाया, सुबह भी जब सुबह वो सोता है तब भी उसको खिलाया. उसके बाद देखा कौन एक्सरसाइज कर पाता है. तो एक कंट्रोल आर्म था जिसमें वो सिर्फ रात को खाता था, मॉर्निंग में सोता था, और दूसरा था वो खाए जा रहा है अनलिमिटेड, बट हमने लाइट्स ऑन करके रखी ताकि उसको सोने ना दिया जाए. वो फिर भी नहीं, तो तब क्या होता था, तो डार्क वर्सेस कंट्रोल में देखा एक तो बहुत अच्छी एक्सरसाइज. सो वी हैव दीस वेरी, आई डोंट हैव द स्लाइड टू शो यू. सो वी हैव दीस स्मॉल rotary things. So you just keep your mouth, it starts doing very fast exercise if it is maintaining its health, but not when it is on a diet which is equivalent to what we get in a McDonald's. So now I hope it is clear to you that we are shifting from a viral to a Western style, but that doesn't mean that virus is eliminated out. Sir can tell much better that these viruses which are coming, you will have it either from orophytal route, like for instance the HEV. Sir can tell better the HAV. And HBV is a DNA virus. Mostly it's a perinatal transmission from mother to child. And HCV mostly from the blood-borne. It's also an RNA. But at least you have some drugs or some vaccines available. But for the Western diet, you may take all kinds of, सबने सुना होगा Ozempic, Monjaro, right? या तो आप वो खाओ और उसके साइड इफेक्ट्स ले लो, या अपनी सेहत पर. Okay, so you write all your CVs every day, what all experiences you have. Now try to do a CV on your own self, which is your health. You know where your hand is, you know where your eyes is, थोड़ी सी problem होगी, but अंदर की internal organs की भी अपनी CV देखो कि are they working or not. So now you should go for health camp, and what I was saying earlier, so now let's have a marathon race or go for a walk. That's much better way of burning your fat, giving less fat to your heart, giving less fat to your arteries, giving less fat to your liver.
Actually, we used to do this practice in the World Cancer Day, the 4th January, we did the big campaign in our campus, and we also associate with one NGO, and we do work with the Jawaharlal Nehru Stadium with our students and all. So we used to do that. But looks like next time we'll start with the liver. That is more appropriate to work. Okay, thank you. So I have one little announcement from the founder president sir, and he was watching the program from 2:30, but program should start in the 2 o'clock, and he's so particular when written the program started 2:30 p.m. And he has written one message. This program is very important and very close my heart. But as you know, at 4 p.m. the voting on 3 bills is taking place at Parliament. In this regard, I am getting some urgent and important calls, so which I am attending in addition of my ongoing meetings. And but still, I will partly watch the program and later I will attend the full program from the beginning because he was waiting, and I have got it put on the Amity YouTube. So you can announce that founder president has put whole program at Amity YouTube, and one can attend the program in India and overseas anytime just writing Amity YouTube, further writing the theme of the program. So that's a message from me. And sir actually very much be associated with the Institute of Liver and Biliary Science, and he had an award. And every foundation day of the liver and biliary science are used to be there. And in the ILBS there is the hepatitis B, which is observed in the month of July. So it's a big program. As well as in the December 4, that is Shipshari started the big campaign in India based hepatitis. So where the Amity University is participating for a long time, I guess more than 10 years.
For the school students and also for the trainees.
Yeah.
So now I think it's an advertisement for all of.
Yeah, and Amity students always participate in the ILB.
These whole labs, so you can have a 2 months or a 6 months or a 6 months. And in fact, right now in my lab, there are 3 students from him who are doing.
Actually, that is the connection I came in Amity. Actually, founders have came in on Foundation Day in the Institute of Liver Biliary Science, and he was talking about better क्या करते हो. तो मैंने बोला मेरा लिवर में स्पेशलिटी है, मैं हिमाटोपोएटिक स्टेम सेल में इंटरेस्ट. बोला बीसी दास है, वो हिमाटोपोएटिक स्टेम सेल में काम करो, वो हम मिलो. तो सर जो हाईजैक स्टोरी दिया, so it's also beginning of this hijack story. So thank you, founder sir. We are very thankful to you. You are listening our program, and this program is little bit different than others. And as I announced, definitely the next year we'll do walking campaign in our campus, even in the other place also we can do based on the availability. And this time actually examination going on as well as some in moment internal test also their students are involved. So we make it in the different way, but not in the scheme presentation, rather than open discussion for the students and panel discussion. Thank you. Marion is waiting for the.
Thank you. Yeah, we are so lucky that founder president sir especially take out time to bless our meeting, this meeting. Thank you, founder president sir. Yeah, because the Institute of Liver and Biliary Science is so close to his heart because of Professor Sareen. That's why also.
Yeah. But Sareen sir always said that is every day he still don't know what is liver because every day is born. So we used to do because a lot of things with that. And I can say that is this time I decided the title actually solid habits and hematopoietic repair from strong liver and cancer therapy. The idea came actually this 2026 Liver Day, World Liver Day slogan was solid habits, strong liver. So when it's a slogan, then I thought that if I not make it little bit elaborated because our institute is a cancer biology and we always think about cancer therapy, and hematopoietic repair is one of my interest. Even in the panel, Suparna sir is working for hematopoiesis for a long time, so I made it for this year. Anyway, so next question. Yes, any questions? Yes, from the student. We are expecting more questions from students.
Thank you, good morning, panel. First of all, thank you for all the information that you provided. As you went through, I am Arnav Bhatnagar from IMSR department, molecular cancer biology program in specific. The information that you guys provided was very eye-opening for us. One of the major things that I was interested in was the approach using metabolomics and using serum to find exact key markers. So as we all give blood tests here and there, at least every 6 months or at least every year, what is something that we can look in the blood tests ourselves that can give us an idea as to if we are going down a path that we shouldn't be, or we need to amp up things to help our liver feel better? Because these are things that when we see such big reports, we get confused and we see one or two things. We see how much hemoglobin is there, how much normal things, not going further to see specific things for liver or for, you could say, your lung capacity. But these are things that I was really interested to see how would you approach it and what would you give us to look for when we are trying to self-diagnose not only, but have a hands-on approach to our healthcare as well.
Will answering? Okay, sir. Yes, sir is a clinician.
So you are asked a primal question that how the state of your health is reflected in the little molecules we test in our blood, right? So in disease and health, I always ask my students one thing, that a patient has come in with a fever, or a patient has come in with maybe a newly diagnosed cancer, or is undergoing treatment for cancer, is recovered from cancer, or has relapsed the cancer. Just look at all the reports. We do a panel of tests called complete blood count, renal function test, liver function test, C-reactive protein, and a few other tests. So tell me, which is the most important one amongst all of them? Just one test that will tell you about the overall health of the patient. And who can tell me the answer amongst the crowd?
Who can answer?
One chocolate.
Who can answer?
Shubhrajit will give you the chocolate, I promise.
even definitely, I'll give a chocolate. Even I'll give a medal also. Yeah.
Come on, have some wild guess. Yeah.
कौन बता रहे हो?
LFT is a whole host of things. It's a liver function test. There is 12, 15 markers. So which is one marker?
In liver function test, Jyoti Sharma.
So you're saying SGOT, SGPT?
Yes, sir.
Just because it's the World Liver Day celebration.
They've got blood CBC.
So no one. I don't believe this. There is one thing that matters.
You
Okay.
can answer.
Sorry.
If the other panelists can answer, is it CRP and IL-6? I think they are the baseline inflammatory markers we have.
It's simpler than that. It's the albumin. It's a serum albumin. I mean, it reflects the state of the liver. It reflects the state of inflammation. It reflects how well your body is coping with all the insults, acutely and chronically. And there is no one marker which gives you the acute and chronic state both together. Say, suppose someone is poor, has poor nutrition over weeks and months, the albumin will come down. If someone gets an acute sepsis, severe sepsis, the albumin comes down. If someone has poorly coped with the anti-cancer treatment, the albumin will come down. So albumin is the marker in the body which tells you the state of the liver and how the body is coping with all the assault it's going through. SGOT, SGPT tells you how well you are tolerating alcohol. But albumin will tell you that after coping with all the alcohol you have taken, how the rest of the body is doing.
I would like to add something. Sir has shared about the clinical aspects, but we are basic researchers. So the future therapeutics, we are looking for the gut dysbiosis, because the topic of your panel discussion is solid habits, and I think dietary interventions, lifestyle as a whole, is having a very great impact on your overall system. And in that regard, gut microbiomes, which are a kind of second brain, they are very important. And it has been observed that whenever there is any gut dysbiosis, means there is a kind of imbalance between the good and the bad bacteria. Those bad bacteria, they have certain genes like cut C and cut D gene, and it is making some metabolites like TMA is one such metabolite, and they are entering in the blood. From the blood, they are entering into the liver as well. They are directly entering into the liver by the gut liver axis, and within the liver there is one enzyme which is oxidizing this TMA molecule and converting it into TMAO. And this TMAO is releasing in the blood and it is reaching to different organs and creating the toxicity. So that metabolite in future maybe that can be again used as a kind of marker to see, because that is the first line of in counteractions of anything, whether you are taking any diet or anything is there. So this TMAO is coming up as a marker, and apart from that, the microRNAs, which are these small, short, small RNAs, they are also used as the biomarkers nowadays, disease-specific biomarkers. So in that way, one of my research is also on microRNA, and what we are doing, we are taking the normal and the patient samples and doing a kind of NGS profiling, microRNA profiling, and trying to find out what all modulated small RNAs are there and what are the specific targets. So just during this discussion only it came in my mind, even Dr. Ivanka and sir is also talking about the specific markers, and basically these are the proteins which they are talking about, and if we can find out what all microRNAs are actually regulating the expression of these markers, because those microRNAs are the post-transcriptional regulators. So then maybe we can have better non-invasive kind of biomarkers available. You can simply take from the blood and try to find out. So we are in process of making some biosensors against lung cancer right now in our ICMR project. We have used microRNAs which we have identified, and we are making biosensor for future, identification and characterization. And we have also observed stage-specific microRNA expressions. So maybe improved early diagnostics, maybe they can help us in a lot, but then it is long way to go. It is only the preclinical research which we are doing, and maybe in future, you never know, we might have success in this regard as well.
Okay, so I would add, you already came to know what are the biomarkers or the markers for finding out whether your liver is working right or not. But then I would, your question, you used a word self-diagnosis. I would suggest please don't self-diagnose yourself. Please, if you have some problem, go to a physician, go to a doctor, because it is like a fashion nowadays to just get a report done and just bother about the report, because many a times what happens, if you don't have any clinical problem and reports give a little bit of upper niche results, you will be bothered, your parents will be, and anybody who does it will. So please don't do this self-diagnosis and self-medication.
Nothing can be more appropriate than what you said just now. Now these diagnostic companies, which all over, I'm not naming anyone, so they are doing a full checkup at 1,000 rupees, 2,000 rupees, 200 markers, 300 markers. Now, do you know what these 200 markers, out of which I would have seen is a complete blood count. So they have 37 markers in the. I am as a hematologist, I'm interested in hemoglobin, total white cell count, platelet count, and some red cell indices. Max to max 10 markers I'm interested. So they are giving some 37 markers. Now some of them, when they're running the test, there is an automated system, a range is given, and they take up red. So out of 37, 4 or 5 red colors come up. Now the people come running that there is something wrong in my blood count.
Yes, that is.
And there is, oh yeah, not to forget, our great AI. Feed it into AI and it tells you, you have this, you have that, and you have everything under the sun. So I actually took the mic to just say one thing. I mean, when you were talking about microRNA. I'm just saying this because the students over here. These bioses. So have you ever realized that we are intruders into this planet? This planet was inhabited by microbes. This planet was meant for microbes. We came over there as intruders. We have to first recognize this with humility. Then only we will understand what is this microbiosis that happens in our body. And the immune system that we developed was to completely fight against pathogens. And as all of that, we can fight against cancer. We reject foreign cells, which is not so good for a solid organ transplant or a bone marrow transplant. But that's how the human system is made. And in that process, over 1 million years, we have learned to live with some of the pathogens, and some of the pathogens have learned to tolerate us. And in the last 5 to 7 years, we are starting to understand that this homeostasis between microbes and the human being, or mammals for that matter, is a very basic tenet of our existence. The day we completely, like Trump, human beings think like Trump. We think we eliminate everything in front of us, we will be better off. So we think that we want to eliminate all microbes from the system. We will perish that very moment. We are surviving because of the microbes. That has to be the basic understanding if you have to understand human biology. Number one. Number two, that was very interesting what you said about microRNA. Now, as students, you understand what is microRNA. You understand what it is?
What is microRNA? What is microRNA?
These are the my name is Malika, and so these are the non-coding RNAs, and they help in critically at post-transcription level. They regulate the gene expression.
So yeah, scientifically speaking, so it is a Three Idiots definition of machine. Okay, so if you have watched the movie, so a machine does this according to the textbook. But think about it. So a gene is there to produce what? To produce a protein at the end of the day. That is the function of human body, to produce a protein, right? A chain of peptides, clearly they are amino acids, peptides, proteins. That's what we do all day long. Now this process involves DNA to messenger RNA, and through translation you go to the next step and you do produce the protein, which then will be degraded as and when needed, etc. Now microRNAs are the ekalavyas of our body. They have been rejected. They are non-coding RNA. Think of the human body as a Mahabharata, as a Kurukshetra, all the time. So they are rejected. They are thought you are not good enough. You cannot code a protein. And they decided that I will do something far more than that. I will control all of you in my own way. So that is what microRNAs are. So think of science like the Battle of Kurukshetra.
It's very interesting, sir. You pointed out this is the central dogma which sir was talking about, the DNA to RNA and then the protein. So during the transcription, the precursor strand is having both coding and non-coding RNAs, and when the splicing is taking place, this non-coding RNA is giving a short sequences which are the precursor microRNAs, and they have a typical hairpin loop kind of a structure. And then from there you are getting the shorter fragment, and it is going and binding to the 5' UTR of the mature transcript and either suppressing or degrading that. So in disease, the protein expression is either higher or lower. So their microRNA mimics or inhibitors can be designed. They are in train, and many of the microRNA based therapeutics under clinical trials as well against various diseases. So it's a very interesting subject for a student's point of view also.
Thank you very much, sir. Already you have mentioned about the pathogen, and our expert, Dr. Sumita Prashad, she is extensively work on Candida albicans as well as nanoparticle. Even my origin PhD also from Ashita of Candida albicans. So we know each other and work together for a long time. So Dr. Sumita, you have a big versatility in the research because you are associated with the nanoscience on the both fungal pathogen as well as nano-based drug delivery. So first I want to know what kind of the inhibitor when we are talking about microRNA and pathogen. What kind of an inhibitor one can against the pathogen using the immune cells like we can use, because we have a lot of publications on that. We know. Thank you.
Thank you so much. Am I audible? So first of all, thank you for inviting me for this panel discussion. And now my area of work is Candida albicans. So first, let me talk about what is Candida. So.
Sound.
Am I audible now? Okay. So first I would introduce, everyone is talking about gut microbiases and dysbiosis. So I'll just briefly introduce about the gut microbiota. So all of us have a particular microbial species as part of the gut microbiota. And the Candida is one of the main microbiota residing in our gut. And normally it is a commensal organism, so without drawing any benefit or without causing any harm. But whenever our system gets immunocompromised, it becomes pathogenic and it then causes fungal diseases. Very often you will find that you have some oral thrush, जीभ में जैसे छाले हो जाते हैं, so that is all because of the Candida, and it's not from any secondary source of infection. It is only because your body is immunocompromised, so it turns pathogenic and you have this kind of fungal infections. Now, when a person gets such kind of fungal infection, so when you are already suffering from one kind of disease, like somebody may be suffering from some liver injury, as all other experts mentioned, which may be because of any reason, because of bad dietary habits, bad lifestyle related habits. So then what happens is that you tend to become immunocompromised and you get affected by different pathogens. You can get infected by some bacterial diseases, fungal diseases, and then you start taking antibiotics. When you take antibiotics, the antibiotic doesn't distinguish between the good bacteria or the bad bacteria. So your immunity will automatically go down.
Once you are immunocompromised, then these candida will become pathogenic and they will cause infection. Now, even in liver diseases, also it happens like that. For example, during ascites. So then, what happens that the gut microbiota it translocates from the gut and goes to the intestine, and from there it goes to the bloodstream. It goes traverses to the different parts of the body, and then one gets infected by different uh, uh, fungal diseases, and there is a systemic distribution of the fungal pathogen. Now, due to unjudicious use of antibiotics, which as one of our experts just now of the diet, she also mentioned that because of Googling, because once you Google, you say, oh, I have this kind of symptoms. So let me take this medicine. They take that medicine, and this unjudicious use will lead to development of drug resistance. And then the common antibiotics which you were taking and were more effective against you than against the pathogen will no longer be working. And gradually you'll get resistant to a lot of drugs. So this is what is the drug resistance. So when you design any drug, so what you do? There are a couple of things that one has to take care is that it should be specific towards one target. So when you design, you want to inhibit the crucial pathogenic traits or the drug resistant genes that are responsible for developing these drug resistance. So as now coming back to the question that Professor Subhajit asked, so first is targeting the microbial proteins or targeting the microbial targets which are responsible for these development of drug resistance. So that is one way how you design the drugs. Next is exploiting, targeting the host factors which are exploited by the microbes to flourish. And third is, of course, you can enhance the immunity, your body's own immunity, so that it is able to clear the pathogens. So, for example, bedaquiline, which is a typical and a WHO prioritized drug, which is used as a part of the drug regimen in combination with other drugs to treat the multi-drug resistance tuberculosis. Now, it primarily targets the mycobacterial ATP synthase, but in addition, it also regulates the master regulator for autophagy and also the phagosome lysosome fusion. And as a result, it helps in clearance of the pathogen. Next is one can design the inhibitors, which are caspase protease inhibitors, so cathepsin protease inhibitors, and this way you can design inhibitors which are targeting towards inhibiting or protecting the body against the protein degradation. So that is also nowadays used as therapeutic way against lot of diseases like osteoarthritis, Alzheimer's. So that is also one strategy. Another strategy is one can use some inhibitors which are preventing the apoptosis of the macrophage. So that is also one strategy one can use against such pathogenic infection which is occurring in the body due to any reasons, which may also be due to the lowering of the immunity, due to lifestyle disorder, or due to unjudicious use of the antibiotics, or due to the some infection occurring as a result of some chronic disease.
Thank you, Dr. Kulika. It's wonderful whatever you have discussed just now. One question I would like to ask, like, how can we design the environment responsive nanomaterial?
So, as for example, I will take the example of liver. So, since in the liver injury, normally there is a pH response. The pH comes down, and there is a extra production of reactive oxygen species. So, these two symptoms or these two markers can be used for designing the smart nanocarriers. Now, what do we mean by smart nanocarriers? That means they are some stimuli responsive nanocarriers. So nanomaterials से हम nanocarrier design कर रहे हैं, which are stimuli responsive, which means normal जब circulation में रहेगा, they will be in proper undisturbed form. But whenever they are induced by some stimuli, they will disassemble and get altered, and then they will release the drugs. So one can use different kind of linkers, for example, the hydrazone linkers, ketal linkers, acetyl linkers, which can act in presence of low pH, and then they can release the drugs. One can also design the drugs which can lead to sequential release of drug. ड्रग के बाहर जो है that is pH responsive, one can design. अंदर का जो core है, they can be designed based on response to the ROS, the reactive oxygen species, which is produced more during the liver injury. So like this, one can use different kind of linkers which get cleaved in response to the drugs, response to the stimuli, and drugs can be released at the targeted site. Also, you can surface modify using different ligands, and then they can those ligands can identify the region where they can bind to those receptors, and they can release the drugs from the carrier, and they can release the drug to the desired site. So these are the different ways that one can design the smart nanocarriers. And when you design the smart nanocarriers, you have to keep in mind that they should not be toxic. And there, of course, with nanocarriers, there are certain limitations or drawbacks which one has to keep in mind, that the scale of production should be high, but the cost should be low. It should not produce immunogenic reaction. So the outer coat of your material should be compatible to your body, and it should not be toxic, and it should not have any adverse immune effect. So
Thank you, Dr. Tulika. It was an eye-opener for us, like how can we make that environment responsive nanomaterials.
और एक बार repeat करो.
Okay, I'm not audible?
No. No.
Is it okay now? Okay. So it was wonderful, Dr. Tulika, whatever we have discussed about environment-friendly nanocarriers. And now it is open for the students to discuss whatever the questions you have in mind, you can ask with the panelists. Yes. You can take the mic.
Good evening, ma'am. So I'm asking this a little on behalf of all of the students, because while we PhD students still have read a little about it, but we don't fully understand it. So we understand carbon to be a relatively neutral thing. So how does converting it into quantum dots influence how it can act actually as a drug for various diseases? And this is a two-part kind of question. So my one of the fields of my interest is biofilms and small intestinal bacterial overgrowth, which happens with liver diseases. So how can something as inert as carbon, when converted to quantum dots, how can it interrupt the biofilm formation process and therefore actually help cure bacterial overgrowth, or even in cases like oral third infection? Like how does, if you could shed some light on that?
yeah, sure. It's a very good question, and I hope it will help all others also to get an idea about that. So now, what are quantum dots basically? So earlier, the quantum dots were those zero-dimension nanomaterials which were mostly made from semiconductor materials. Now, the semiconductor materials had this drawback that they were toxic. So now the emerging class of nanomaterials came ahead, which came to be known as carbon quantum dots. Now, for carbon quantum dots are made from any kind of carbon-containing precursor material. But when you change that material to carbon quantum dots, it becomes zero dimension.
but it loses the original characteristic, and then you can impart your desired optical and other properties to your material. Now, carbon dots itself are not so toxic up to good concentration. So the question that you asked that for microbial biofilms, whether it is actually killing or not, whether it is cidal or not. So now my answer to this, because I have been working extensively on carbon quantum dots since the last 10-12 years. So carbon dots itself, till a very high concentration, say 4 milligram or 5 milligram, they are non-toxic, and even they are non-toxic till a very high concentration to the cell lines also, and even to the in vivo model, to use the mouse model, so they are non-toxic. So now how you can use them to counter the biofilm? So as itself, the carbon dots, they are non-toxic to the microbial pathogens, so you cannot use them as an inhibitory molecule itself. But of course, they can be used as a theranostic agent, where you can link it with some drug or use it as a drug nanocarrier, or you can make composites where, like we have made composites containing the carbon quantum dots, as well as some inhibitors like even the curcumin, which Professor Vibha has also used, and silver, all at non-toxic concentration, and then made this composite as an antibiofilm agent. Or so you need to have some other material also in addition to the carbon quantum dot to impart the microbicidal action. So I hope that answered your question. And I think
is it clear to all the students? Any question? Further question? Yes.
My name is Kirmi, and I am an MSc Molecular Medicine. My question is Dr. Dilika. Now that you mentioned a lot about the nanocarriers, nanomedicine, what would be the prospect of biomaterials as a nanocarrier? Because now that we've also talked about the toxicity of carbon quantum dots, work talked about silver nanoparticles, and they're also non-toxic at certain levels. But the moment they increase it, the toxicity of it. So what do you think if we use biomaterials instead of these initiation products, how would it affect the toxicity?
Yeah, very good question and very relevant too. So yes, biomaterials of course are very good sources. Like we have published one paper and we have patented one more work of ours where we have used the nucleic acid derived carbon quantum dots. So like DNA dots and RNA dots. And we did till the in vivo model checking, and we found that they could be cleared from the body within 24 hours, and they were not toxic at all. So then that increases its potential to be used as a carrier for human applications.
And adding to this question, were they stimuli responsive at all? Maybe pH or temperature sensitive?
So by inherently the such kind of biomaterial derived quantum dots, carbon quantum dots will not be stimuli responsive. You have to design it. So you have to give pH sensitive bonding, like you can have ketal, you can have hydrazone. So you have to link your drug with those linkers which are responsive to those pH or say low oxygen level or say high ROS levels. So once it goes to that region where any of these stimuli are met, automatically that cleavage will be formed, and that linker will be cleaved, and the drug will be released at your desired area.
Thank you, Dr. Tulika, and thank you, student, for asking the question. Yes.
Good evening, panel. My name is Chris, and I'm from chemistry stem cell. So we were talking about biomarkers in cancer, so it's treatment. So how feasible it is to combine circulating cDNA and cancer stem cell markers for biomarkers and therapeutics?
So you would like to ask about the circulating, circulating cDNA. So yes, it would be a very good therapeutic approach. Like we have come up with ddPCR. You must be aware of digital droplet PCR, which really picks up the circulating these markers which we have. So which I think would be a very good approach if we complement the NGS, as Professor Vibha was talking of. So it's a very complementary technique with NGS. Whenever we would like to come up with any biomarkers, if we are putting up any promising biomarkers to be acting as a prognostic biomarker, so they're using ddPCR, we can pick up these circulating cDNA which are there in cancer patients. So we may, look out for any SNPs, any polymorphism, or any rare mutation if possible there in the patient. So that can be picked up very well, and yes, it can be act as a good biomarker in near future. Yeah.
How about therapeutic as a thing?
As a therapeutic targets, yes. Like I've worked on, like if I talk about few targets, like sphingosine kinase is one of, just an example if I talk about. So sphingosine kinase, it's a kinase which mainly converts your sphingosine to sphingosine 1 phosphate. So this is acting as a lipid, marker which is mainly required for. So this sphingosine kinase is one of the target as a therapeutic target where we have used PF543. You must be aware of. This is a known anti-cancer drug. So what we had done, we had repurposed this drug where we wanted to check the role of this PF503, whether being an anti-cancer drug can also act as an anti-leishmanial drug. So this PF503 is known to act against the sphingosine kinase. So if we target this sphingosine kinase, we found that yes, the PF503, that's the sphingosine kinase inhibitor, is preventing the leishmaniasis in patients. So that way, yes, you can pick up your molecules which may act as a therapeutic targets. Thank you.
Thank you, Dr. Imanka. Very well narrated.
I'm Ramya. I'm doing BSc Biomedical Science. I'm in my first year. So my question is from Professor Gayatri. As you mentioned about different very common factors like alcohol, smoking, and fatty foods that affect the liver, I want to talk about something that is more common in the US, that is mental health, stress, anxiety, and depression, that apparently also affect the functioning of the liver as they associated with the nervous system as well. And they induce insulin resistance in the liver and also reduce blood flow. So, to an extent, it can stress be the new major culprit of liver diseases compared to the other common factors.
So that's a very complicated and a very good question. I don't think I have a good answer to that. So there is something called as a gut, liver, and a brain axis, right? And not in and certain is better because he's a physician. In certain places like IBD, where there's an intestinal bowel disorders, there mostly it has been actually linked with your the nervous impact. So that's the only thing that I know of. But when it comes to the liver, there is a vagus nerve that connects the liver onto the brain. So there are now a few studies where just by stimulating the vagus nerve, you can actually affect the regenerative capacity. So now it's nothing to do with the stress, but you think of the other way around. The type of nutrition that you are taking, and especially with respect to alcohol, that alcohol itself has an effect on the brain, right? So that kind of a thing which is actually right now being tackled in ILBS is through the counseling sessions. Okay, so where you actually reduce down. And why just the liver only? It's the patient's attendant who is actually working with. They also need that way a lowering of your stress levels. So yes, as Sir said, everything is connected, and there's a lot now coming up with the so-called gut and the neuropsychological.
I will just mention something. Your question is a very pivotal question in medicine, okay? So think of how physics has evolved. So particle physics or Newtonian physics. And what came after that? Einstein, Bohr, Schrödinger, what did they bring about? What was the next level of physics? Quantum physics, right? So quantum is same as the Vedantic science. So biology or human biology is right now stuck in the particle physics age. We are trying to find a cause-effect relationship to material means. Means we are looking for one chemical, we are looking for a physical relationship, we are looking for a chemical relationship between one and the other. What we have not evolved into is quantum biology. which is the next leap which we have not been able to take. What you're talking about right now and what I've been interested in for a long time is this, that what, I mean, in current practice, to say that stress is affecting the gut, liver, or cancer, we have to find a chemical or a physical connection to prove it. Once we get into the quantum aspect of it, if we can go to it, we will not need that. We can still prove. So that's where the next leap is. And that is where the body mind connection will come in.
I would like to answer your question. As we are working on stress biology, we are giving various stresses to animals and we are seeing that how it affects them. So certainly the immunological compromise is there. So when immunity get reduced, then there are various diseases which can get elevated. So liver disease is one of them. So stress is very much related to liver disease. You are very right in that.
From Engineering Department. Now, my question is, Professor Subarno, sir, is there any point in liver degeneration actually becomes harmful instead of being beneficial?
See, liver will, I mean, everything is a homeostasis. It means liver won't regenerate out beyond what is needed. If it does, it becomes a malignancy. So what your question actually leads on to is, whatever, when the regeneration is beyond what the body needs, it's a neoplasia. Hyperplasia is within the physiological limit. When it goes beyond that, it's neoplasia. So what your question essentially means is, when you go beyond that, it becomes neoplastic. You get something like a hepatocellular carcinoma or cholangiocarcinoma. The same applies to blood, right? From leukocytosis, it becomes leukemia. So from just a rising white cell count, it's an unregulated white cell increase. So it becomes a cancer. So anything which is growing more than what the body needs and cannot control it within its means is neoplasia.
Thank you, Sir.
Myself, Drishti Chhabra from Biomedical Sciences field. So my question is, since chronic inflammation is a link between liver damage and the liver cancer, so there are some hematopoietic repairs that so can they really help us reduce inflammatory microenvironment, or they mainly focus on the tissue regeneration?
I think, of course, hematopoietic regeneration is, the cells are not doing well. So, of course, आपका जब regeneration हो रहा है, तो it can evade the immune response very well. So, hematopoietic regeneration, as you're saying, the stem cells are working fine, your blood forming cells are working totally okay. But if not, then, of course, you will be more prone to infections. You'll be more prone to, as you must have seen in elderly patients also. So, they are more prone to this. But, yeah, there's a paradox again being associated with elderly patients with aging, as one question came up to me. So there it's been also been said that these patients, though they have a very small repertoire of T cells, because there's an exhaustion of T cells, when immune function is not really working well. So, but they are more focused, they are more concise, so that way they work really well, and they mainly target the new antigens, mainly the cancer antigens we are targeting. Yeah.
Thank you, sir.
Students, any other questions?
Sorry, taking your time. So, he asked about that stress factor and liver disease, right? So, ma'am has already mentioned about the vagus nerve. So, there is one more aspect, because the vagus nerve also has an impact on the mood. That is why it is very commonly said, when you are very angry or when you are not in a good mood, don't eat at that time, because your digestive system gets impacted. Similarly, the liver gets impacted as well, because it's connected to that. So again,
nice lifestyle like watching a movie, aggressive movie, or not an enjoyable thing. You're watching everything on your mobile and eating. So that again impacts your digestion and then indirectly to your liver. It's there.
And as she's mentioning, I think bone marrow, you asked hematopoiesis. So again, the dietary pattern plays a role. Start having, the vegetables, like it's been said, start having broccoli, start having, vitamin B12 and folate supplements so that you are more uptaking more of these supplements in a way, hydrated, more fiber intake so that they all help in repairing the DNA repair. आपका जो DNA repair होगा वो that will be intact. So that way your blood, your this stem cells would be very retained well. The cells would be there. So it's like liver and your bone marrow. So they all are all interconnected and they are all related to the having a 12-hour time sleep. That's being said because it's an autophagy process which is ongoing, which removes all the toxins from the liver and also the damaged mitochondria in the liver. So that way, this is all how I think everything is all interconnected.
There is one way to interpret it, means how to simplify all of this, okay? Check if your grandfather or great grandfather has lived up to 80 or 100 years without much disease. If they have, just find out what they ate and just eat that.
I just want to add that the system conceptually everything is all set. This is the thing, but there is a very complex kind of system that we are having. There is a combinatorial interactions which are going on. Networkings are there. Everything is interlinked. Even the pathways are interlinked, and that's why everything is related. Even the stress is generating the ROS. Your inflammation is also, even the drugs which we are consuming, that is also having the additional threat on the body. So that's why the dietary interventions, your gut health is very, very important. From my side, the take home message is be happy, be stress free, take fibers, change your lifestyle, and ultimately your body will be happy too.
Almost we have to come into the conclusion, but another question we have the student.
Okay.
I would just add something onto it. See, the thing is, fiber, we have learned the word fiber from the West. Okay. So there is a trend in the West of having protein and fiber diet. The diet would have only protein and only fiber. It's called maxing diet. And there are deleterious effects on the body which are being recognized a decade later. So whenever we do things in excess, there will be problems. Human body is all about balance, a balance of mind which brings the balance to the body. Do anything in excess, you are in trouble.
The questions. Next question.
I am from BS Biomedical Science. So my question is related to mostly the diagnosis. So as we spoke about the microbes, so I have read the study about it. There is a TACE that we inject directly into the liver that will only shrink the carcinoma in your liver, but it will not completely degrade it or remove it. So we prefer surgeries over it instead of using it. So if a person has some problems in liver that can't be have a surgery, so would we prefer to use this drug over that person? And another thing is that can we trust this kind of drug that can be directly injected to the part of the body and it will cover it up instead of going to a surgery procedure?
What your taste is basically transarterial, means you're directly injecting into the hepatic artery. You're expecting that drug will go to the tumor and hit the tumor and nowhere else. It's basically done for cases where you cannot do a surgery and take out the tumor. So obviously it cannot cure the tumor as such. Now no drug can cure the tumor, no surgery can cure the tumor because tumors are killed in logs or cancer cells are killed in logs. It never reaches zero by chemicals or radiation. The last cancer cell is always taken care of by your immune system. So even if you have nicely taken out a tumor, you have given the best possible drugs, and you after that your PET scan says or the bone marrow examination says that you have no cancer cell. A year, 2 years later, the cancer comes back. Why? Because the immune system has not been able to take care of the last cancer cell. So the last cancer cell is taken care of by your immune system. Always remember this. The immune system is forever preventing cancer from happening in our body on a day to day, hour to hour, minute to minute, second to second basis. So respect the immune system, it will take care of.
There is the question.
My question is for Professor Vidharani. Hello, ma'am. I am Sinha from MSc Biochem. What biochemical changes occur in aged garlic when we keep it in an alcohol for longer period of time?
As I said, that this garlic is rich in sulfur compounds. The secondary metabolite which I was talking about, the plant is having primary metabolites, and from there secondary metabolites are synthesized, and which are actually the therapeutic molecules. So garlic is majorly, it is rich in the sulfur compounds. When you are putting it in alcohol, the stability, some bonds are there which are changing. The stability is enhanced, and when you are consuming, it remains longer time duration in the body. It is giving better effect, and apart from that, the smell which is coming, in the garlic, that is also lost. So all those changes are there, and that's why it is shown to have. We have done the HPLC kind of studies as well, and we observe that as compared to the developing garlic, the aged garlic are having higher amount of the secondary metabolites which are present.
Okay.
Because of, what's bringing about these changes?
Methanol, we are adding alcohol. So
Exactly. So it's alcohol at the end of it.
yes.
So it's not all bad, right?
No, but that is methanol, which is bad. Ethanol, I can even think of, but no, methanol is definitely not good for your health as well.
It's like pickled
So we are
vegetable, right?
actually extracting it, lyophilizing it, making the powder form, and then you can take it in the tablet form or whatever. You can make some suspension. You are not directly taking that methanol cocktail.
Good afternoon again, panel. I had one question. We've gone through a lot of health visits that you guys all mentioned. I'm quite interested in extracellular vesicles, and at least in hepatocarcinoma, it's been seen that patient samples end up having more ED in general. So I want to ask: do you think that is there an application of extracellular vesicles as of right now? Due to their robust nature of not just isolating them, but how to purify them, and what could be a potential thing that I could potentially focus on. As I'm also interested in liver cancer, and I'm researching as well as that. I want to find a different average unit, although I did really like that therapeutic aspect. I did know that there were natural antidotes at this point, which are so readily available that we didn't know how to utilize them.
Yeah. So, who is answering, Viva?
Vibha ma'am is answering.
Okay, you want.
We had a nice question.
Yeah, ED.
Extracellular vesicles. So this is, you should read a paper if you are that interested. You have just got paper.
It was
He
fantastic.
is the master student.
Yeah,
He has
master
also.
student, but this from the institute the paper is out in the laboratory molecular medicine, so you can read the paper and BSc cancer. I You can come to the lab, we'll tell that how it is, can be as a marker, or the EV can be extracted, how can be extracted, and then how it is, it's a long procedure. And then EV can have the, just now she told about microRNA. So it can be as a marker, it can be as a therapeutic target. So you can identify specific marker. So probably mRNA marker or any other marker which is carried over by the EV, the extracellular vesicles. So they are nowadays very much very important biomarker. So this you can come and detail. So you can log into.
You will see many publications where EVs have been extracted and then the NGS profiling has been done to compare the kind of biomarker discovery. Even the stage specific profiling has been done and cancer specific profiling has been done, and they're trying to find out the unique molecule specific molecules. Regarding your natural product, again, there's a myth. You cannot take randomly like that because we do have the toxic compounds present in our Indian medicinal plants. So there is a need of doing extensive characterization, understanding the molecular mechanism as well. The way curcumin sir is using as anti-cancerous molecule, where it is killing the cells. I am using in cardiac protection where it is protecting my cells. So how a single molecule is actually doing dual kind of response. So we have published that also, and we found that it is the more specific nature of the natural product. If you are giving pre-treatment or the post-treatment, the responses are different. In one way, it is cancerous. So this is not a kind of generalized. We can see many shopping sites are there, and they are giving you the kind of products, herbal products, but no, they are toxic too. But yes, definitely they have come up as a magical molecule in a sense, because now we know that diseases are having multi targets involvement, and these plant derived natural products, a single plant can have multiple such secondary metabolites, and each and every metabolites can target to a specific target. So it is a kind of mini combinatorial library, the natural products or the plant extracts, many libraries of therapeutically important molecule with multi-targeted approach they are having. Many exo and endo interactions are going on, and in that way it is better, but you have to characterize it first. Try to find out the mechanism, and then definitely you can get some good molecule that can be taken further in the herbal drug discovery. And I was going through one paper long back where it is claimed that 80% of the drugs which are coming in the market, they are having one or the other information from herbal products only. Either the chemical structure, then they are modifying it, developing in some other molecule. So this is a good field to work, but then you should have patience. Without stress, you have to do with that work also.
We have to come into the conclusion.
Yeah,
because
sure.
taking the
EV,
last
Oh,
okay.
Please.
Please.
Already, I think she's given a brief, just a brief, like as a basic question you had asked. So what normally, we have one ongoing DRDO project. What we are doing, we are having some IPTP troops, soldiers we are collecting, and also the baseline C-level soldiers. So what we are extracting is we are isolating EVs out of those soldiers, just as we have a C-level, mid-level, and the high-level soldiers we are collecting. So the basic, how you can isolate EVs, we do have ultracentrifugation as one technique. Another is the EV isolation kit. We have specific kits available for EV isolation. And once that is done, you start characterizing them. So that can be done either using your LTA, or you can use TEM, that will tell you the morphology of EVs, like how much micrometer, like the size of them. And of course, you can look out for flow cytometry, Western blot, as few molecular tests which are being done in laboratory. So once they are characterized that yes, they are the plasma specific EVs, platelet derived EVs is what we are specifically focusing on. So once that is done, then further you can go ahead with, like, as we are focusing on cardiovascular, the status of these soldiers. So we are mainly looking at the vascular dysfunction genes. So we have CD31 alpha SMA, we maintain kidney. So this is how you can look out for all the signaling pathways which act downstream of your novel, biomarkers which you may come out for.
Good evening to all panelists. My question is even a little related and compared to what all
I'm Sarma. I am biomedical science student, my first year. My question to all is, can increase the disease in thyroid lead to non-alcoholic hepatitis, irrespective of how good a diet one can have? Because honestly, in today's time, every pregnancy may or may not have been adulterated. So, how does that But now, at this point, everything is adulterated. How does it
So I'll combine what both have said. So I'll not say about the adulteration as part, but even if like it's as I said, it should be a moderate level. It's not that you are taking excessive. So what the liver is doing, so it's actually what if you're taking the a high carbohydrate rich and a high fat diet, at that time everything which you are taking in, the liver is actually a store organ for not only the lipids but also for the glucose which is coming, and it gets stored in the form of a glycogen. So as sir was saying, everything is actually made by the nature for a good. You don't want too much of a circulation of the lipids. So where will all this lipid that you are taking? So it's actually getting stored there. But there will be a time when there is an excess of the storing that's taking place. So at that time, even the liver cells are not able to actually take this lipid into a beta oxidation pathway or for a lipolysis. So it has only two ways to now do. Whatever lipid now is coming, I'm not able to store it, so I throw it out. The other is I keep on storing as much as possible. So the so-called fatty liver, which is happening actually because of the so-called deposition of the fats in the hepatocytes. And what the hepatocytes then look like, they get ballooned. They are no longer the so small hexagonal type of cell. They become really ballooned now. Now there are, and we always think it is a fat person, so more fatty. But now what the literature from the Indian society is telling, that there's also a lean fat. I may be a lean person, but still.
Students, please keep quiet and listen. Please keep quiet.
Accumulation of this fat. So that's where what Madam said was genetics is very important. So at least from the European studies and from the Indian study, there are a few genes which are known, and those genes are actually helping in the metabolism of the lipids. And something goes off because there is small single nucleotide polymorphism, then what will happen? There will be more accumulation. And some of these so-called risk allele is actually high in the Indian population, or I should say like a South Asian population. So these genes also have ethnic differences. So the genes which we have in India may not be the same as that in the Europe. But there are few genes, for instance, one of the genes is PNTLA3. And the function of that is actually helping the lipolysis of the lipid through the beta oxidation path. So if there is a mutation occurring, so you have a germline mutation. So as sir was saying, see what your forefathers were eating or what their lifestyle or their genetic makeup was. So maybe you got inherited a gene which is not helping the building up of this lipid or which is causing more building of this lipid, can then cause a defect. So it has both a genetic as well as a nutrition. Means building up of the fat. When you say steatohepatitis, means these balloon cells attract the immune cells. Why? Because either it is through some kind of exosome these cells are releasing, or through certain secretome, or through certain cytokines, immune cells come to clear them up. But what happens is that at that time there's a lot of injury occurring. When there's an injury occurring, there's a bystander effect. Not only the balloon cell with the lipid is dying, there's also normal cell dying out. So continuous accumulation causes NASH, then NASH is what causes to progression of the fibrosis. So it's a continuum of it.
Coming to the conclusion now, because it's almost 55. So, maybe short question actually was request came from the Guinea because she yesterday texted me, sir, can I read some paper for this?
So she has read a lot of papers, it seems.
Since you said you work on natural products, so has there been any correlation that has been drawn, like just mentioned while in discussion with Sir, that he works with curcumin as a killer molecule and you work for it as a protective molecule? Is there any structure which is actually defined where exactly the molecule would act, how exactly? Any correlation?
Actually, as I'm working on cardiac protection and this curcumin I used in drug-induced cardiotoxicity, anti-cancerous drug-induced, where we have taken doxorubicin, which is a well-known anti-cancerous drug, but it has reported to have potent cardiotoxicity as well. So we thought to take a few common targets. So by using the bioinformatics approach, because this cardiovascular diseases itself, if you see, there is a lots of signaling pathways that are operated, and crosstalk is also there. So we selected few targets and we did some molecular interaction analysis, and wherein we found that it is the matrix metalloproteinases, which is very important enzyme for ECM remodeling in heart, that is having a zinc binding domain, and this curcumin is binding to zinc there. And even there are other genes as well. So they are binding to that particular pocket, and then it is having some kind of effects there. Another off targets also we checked, and what we observed that if we are supplementing doxorubicin with curcumin, because they are sharing the common site, binding sites, there is a competition, and because the affinity of doxorubicin was higher, doxorubicin was binding first. By molecular simulation analysis, we observed that. So it is not giving chance to curcumin to bind and show the protective effect. And then net towards toxicity we are moving. But when we are treating the sets with curcumin first, and after 24 hours when we are treating it with the drug, then there is a opposite effect. We see that it is deep towards the protection and cell survival pathways are activated, and wherein certain transcription factors like CATA4 is one such transcription factor, it is having modulation and overall cardiac protections are observed. So that's why I said mode dependent mechanisms were there, and that was the hypothesis which we proposed in one of the paper by doing all these studies. So definitely yes, sometimes they share the common sites, pockets, but that's not a generalized kind of rule. Someone has to do extensively and then try to find out, because there are many targets. It's a exhaustive kind of work. But yes, one or two targets which are well known, we tested on that and proposed this kind of.
So students, we will share the details of all the speakers to you. You can talk to them later because now it's very high time here. Time over, and they have traveled a long distance to come here.
I'm requesting all the panelists to say just 1 minute concluding one from all of you.
I already gave. For me, that this biases definitely one has to correct by taking proper diet. Each and every lifestyle factors are actually contributing, and I'm certain if you have good health, good immunity, you can, I think, fight with any of the diseases. As Sir said, that this last cancer cell, it is your own immunity that will kill it. And from where it will come? It will come from proper lifestyle, meditation, stress, bilkul nahi lena hai. You have to do some kind of exercise. The concept of, I'm just leaving few words, probiotic, prebiotic, symbiotic, and postbiotics. You have to just take that also in your mind and then just try to move ahead with happy feeling. And thank you to the students actually, because they made this session so interactive. Questions पूछे तो हम लोगों को भी थोड़ा सा mind open हुआ, वरना हमें भी stress ही होना था. So thank you so much all the students. You can clap yourself for your
Oh, yeah.
So, how much did you learn today?
Yeah, that's very important question.
No answer.
I take one concluding remark from today's also.
What are the solid habits you have learned?
So, if I ask you, that today, if you have read all the books in the world, all the journals, all the papers published until now, how much would you have known about human biology? So, conservatively speaking, I would say 0.000001%. Okay? So, that is the humility with which you should approach the subject of human biology, that nature has created this wonderful thing which will not be possible for one generation, two generation, 10 or 100 generations to discover. We will keep on attempting to do so, and with that attempt, there has to be humility. Without humility, knowledge is useless. So that is why the greatest rishis of our ancient times, to the last day of their study, when they used to teach, when they used to study, there is this Saraswati Vandana where it says, where it ends by saying that Vidyarambham Karishyami Siddhi Bhavatu Me Sada. Means I'm just starting to learn and may I succeed in this process. So till the last day of your life, that should be the motto. Thank you.
Dr. Meher.
So I would just reiterate what Suparno sir said a little while back, that your immune system can take care of everything. And the mantra to keep your immune system healthy is to stay positive and stay healthy. Stay out of stress, like you said. So if you stay out of stress, I know stress is very easy to take, but like we say here, stress lene ka nahi dene ka. So do that and
Dr. Ivana.
I उसको pass on कर देते हैं.
Yeah. So as per me, the take-home message is that you should shift your focus from late-stage prevention, late-stage treatment to early prognostic diagnosis, and the treatment. And along with that, you should focus more on the biomarker-driven personalized approach. So I think there is where the science lies in. So we should have an early prognostic biomarker-driven approach so as to treat this thing. Thank you.
Dr. Gayatri. Dr. Kulika. You cannot hear, I guess. Louder. Speak louder.
Audible?
Yes.
Okay, so I repeat, so it was wonderful coming here, learning so many things, new things for me as well, from all experts as well as from the audience also. And the message I would like to give is excess of anything is bad. So you have to maintain a balance, balanced food, eat healthy, live healthy, sleep healthy, and work healthy, and avoid having a sedentary lifestyle. So everybody needs to have a active lifestyle. In addition to you are doing studying, you are doing anything, but you need to have avoiding your sedentary lifestyle. So there has to be a balance in everything you do.
Thank you very much. So one concluding remark from the student that Kaushik is telling, right? Kaushik.
Everyone. I'm Kajal Saini from AC Medical Lab Technology. And I have a question for you all
that as nowadays number of smokers and people who drink is increasing, is there any molecule or natural herb which can do as much beneficialistic to the harm by smoking and alcohol done? Or also, if not as much beneficial, but people who quit them, the herb can at least recover the damage done already.
Very short answer because we have to finish. She is asking herbal products for this.
I think, yes, there are many drugs. Again, natural products are also there. But then again, someone has to first find out. It's a huge piece of research. She's asking in just very short period of time. But yes, you can do that kind of research. There are certain plants which are one of my colleague is doing that kind of work where she has made some smoke induced models and she's testing some medicinal plants and she has observed a very good effect. And now we are making a kind of formulation, novel formulation, and she has submitted the patent also. And that is having very good effect on the smoke-induced pathologic conditions and the kind of ROS, antioxidant, the oxidative stress, which are there, different kind of inflammations, molecules, IL-6, TNF-alpha. It is having very good effect on the NF-kappa B expression as well, which is leading to ultimately the inflammation. So yes, there are natural products, but then someone has to definitely do some extensive research to find out the differences, to find out the gaps, to find out the potential, and maybe in future some formulations covering 2-3 things together. Even we are trying to use EVs for natural delivery, just to make the body self kind of feeling. We are integrating the small molecules in the EV vesicles and we are trying. So yes, everything is possible conceptually. Again, I said conceptually everything is yes, but then someone has to prove it.
Thank you all the students and thank you all the panelists for having this extensive discussion. Let's have a big round of. So now I would like to welcome Professor B.C. Das sir and Simran ma'am and Dr. Kajal and Dr. Biswas to felicitate our panelists. Yes.
So, sir, please come here.
Sir, please come here. Dr. Suparna Chakrabarti. Please welcome Dr. Suparna Chakrabarti, sir. Thank you, Professor Gayatri, ma'am. Thank you, Dr. Ivanka, ma'am. Dr. Ivanka. Dr. Mehak Agarwal. बेटा महक मैम को. Then Dr. Tulika Prasad. And then Dr. Professor Vibha Rani. Now we can have a group photograph for everyone. कर दिया हो गया. Yes. Oh. Dr. Tulika, sir. Now we can have a group photograph of all the panelists.
Please sit down. Yeah, before that, I have a one small announcement because the student encouragement and their participation is very well appreciated. So, as sir mentioned, that chocolate even is better than chocolate because we added some medals because panelists will beat them. So, based on the interaction, I am just announcing the student name. They can come and sir, you guys, I'm asking Dr. Shupolu sir. Please come. And Dr. Orno Bhatnagar, please come. Jyoti Sharma, please come. Please come. Yeah, what is it? Please come. What is it? Please. Malika Ranjan. Malika. Okay, Dr. Shimran, please come to do the. Please, Dr. Shimran. Give me. Give me. Yes. Okay, Dr. Kajal, are you there, please? Next is, yeah. Romina? Dr. Ivanka, can you come? may I be called? Dr. Viva. Oh, Viva already given. Dristy. Dristy. Oh, Dristy Chabra. Oh, Dristy Chabra है, जैनन भी है. तो ठीक है. अच्छा, डॉक्टर सुजीता. अच्छा. मेरे से. अभी Ishita. Ishita. Okay. Dr. Gayatri. Okay. Arati Tama. Lastly, Kaushik. So, yeah, so already say more than 5:30, only 5:25. Yeah, so we have to finish. So I'm not taking too much, just a vote of thanks. Thank you all for the panelists to be here. And I'm very happy whenever I have written the letter, everybody accepted to come. So thank you very much, all panelists. I'm not taking a name individually. And thank you all in Amity Institute of Molecular Medicine and Stem Cell Research faculty, students, PhD student, as well as postgraduate and graduate student. Thank you very much for this interactive session. And I want to thank the maintenance IIT, as well as the IIT team, as well as photographs and the team. And nevertheless, yes, I want to express my gratitude and thank you to the honorable founder president, sir. That is, he always says that his liver is my heart, the program. And thank you, founder sir, for that. And I want to thank you the chancellor sir. He is also so much active in this regard. And honorable vice chancellor sir, Chandradeep Tandon sir, vice chancellor, already he was there. So I want to thank from the Amity Institute of Molecular Medicine and Stem Cell Research. And this institute belongs to the actually domain bioscience and biotechnology domain. So like Dr. Marion is there. So I in the end I can ask Dr. Shimran, uh, can you felicitate Dr. Marion? And I should be felicitated also, but she's fine. So we care co-moderator. Thank you, Marion. Thank you. Okay, ठीक है. मैं भी आ जाता हूँ. Thank you very much. So we already came into the end, and the snacks is available in the outside. And sir, please have a tea and the high, so far high tea. And thank you very much for coming.